Gentlewoman from New York is recognized for 1 hour.
Thank you, Mr. Speaker. For the purpose of debate only, I yield the customary 30 minutes to the gentleman from Texas, Mr. Sessions. All time yielded during consideration of the rule is for debate only, and I ask unanimous consent that all members have 5 legislative days within which to revise and extend their remarks and to insert extraneous materials into the record.
Without objection, if the gentlewoman will suspend.
I yield myself such time as I may consume.
If the gentlewoman will just suspend, the House will be in order. Gentlewoman from New York.
I yield myself such time as I may consume.
Gentlewoman is recognized.
Mr. Speaker, H.Res. 774 provides a closed rule for consideration of H.R. 3963, the Children's Health Insurance Program Reauthorization Act of 2007. The rule provides 1 hour debate equally divided among and controlled by the chairman and ranking minority member of the Committee on Energy and Commerce and the chairman and ranking minority member of the Committee on Ways and Means. Mr. Speaker, I stand before you on the floor this morning with mixed emotions. I guess it's this afternoon. I, along with the majority of members of the House, are disappointed that we are forced to reintroduce a bill passed by enormous bipartisan support, which would have provided millions of children across the nation with access to health care. The memory of what took place here on the House floor, Mr. Speaker, the House is not in order.
Gentlewoman is correct. Will members please take their conversations off the floor? Gentlewoman from New York.
We're sorry that we have to reintroduce a bill passed by enormous bipartisan support, which would have provided millions of America's children across this nation with access to health care. The memory of what took place here on the House floor a week ago today will not soon be forgotten. On that day, we saw a few members stand in lockstep with the President and with that deny health care coverage for millions of our children. However, coupled with my disappointment, Mr. Speaker, is the consuming feeling of promise. I have hope for those children, along with the belief that those members who are unable to break away from the President's mistaken rhetoric will stand for what is right today and vote to overwhelmingly pass this vital legislation. I feel strongly that what motivated me and so many of my colleagues to come to Washington in the first place was the thought that on any day, a vote could be held that would improve the lives of millions of people throughout our country. And that is exactly the chance that we have been given here today. We are again granted the chance to vote for a bill that will advance medical care in this country, improve the health of our youngest and neediest citizens, and offer new hope for literally millions of children who would otherwise be left without either. I think that everyone listening today recognizes the reality of the situation we face. Should we not act, the health care of millions of children will be yanked away on November 16th. And not providing health care to millions of children when given the opportunity to do so is appalling. But to strip away benefits from those who currently have them is simply indefensible. Mr. Speaker, in our vote to expand SCHIP last month, we made a genuine dent in one of the most shameful inadequacies of our health care system, the lack of coverage for millions of America's children. Congress created the State Child Health Insurance Program in 1997 with broad bipartisan support, including some of my colleagues who now oppose it. And as a result, over 6 million children currently have health care coverage that otherwise would not. In my home state of New York, over 400,000 children are enrolled, the second highest in the nation. The SCHIP reauthorization bill would preserve access to health care for 6 million children already enrolled in the program, while bringing desperately needed health care coverage to almost 4 million more children. And as a result, in my home state of New York, an additional 268,000 children who need it will have health care coverage. That means they'll be able to get their immunizations before starting school or see the dentist when they have a toothache. And this new bill also makes changes by phasing out childless adults from after 1 year, and also puts in a cap on children whose parents' incomes are over 300% above the poverty level. In addition, the bill also requires states to develop plans and implement recommended best practices for addressing crowd out. Make no mistake, 43 governors from red states and blue, 69 members of the United States Senate, Democrats and Republicans, 73 of my colleagues from both sides of the aisle in the House, and 81% of the American public, including a large majority of Republicans, support our bipartisan expansion of SCHIP. Yet presented with this overwhelming support from all sides, the President decided to dust off his veto pen and with it deny millions of children access to health care. In spite of the unquestionable benefits, in spite of the overwhelming popularity and accomplishments of this program, SCHIP is under attack. We saw reprehensible smear attacks on families who were brought into the public eye to showcase the benefits of the program. In the face of the life-saving chance that was bestowed on a family due to this program, the harshest rhetoric was not cast against the bill, but against this family, including the children. We saw persons go to the home of one of the families and harass them in public. Talk radio and blogs made wild and audacious accusations, and we even saw staffers on Capitol Hill who clearly intended to assist this fabricated, cold-hearted smear campaign. It is beyond comprehension to me that many are willing to score political points by denigrating our nation's children, particularly those who owe their very lives to this program. But the American people saw through the attacks. They understood that the health of our nation's children is simply not worth scoring a few political points. Mr. Speaker, the President chastises the $35 billion bill, which is fully paid for, as too expensive. And with the same breath, he seeks an additional $190 billion for the Iraq War, all of which is at the expense of the taxpayer. This is simply unconscionable when you realize the amount of money it takes to provide the health care for 10 million children for an entire year. It's what we spend in Iraq in just 41 days. We need to get our priorities straight. Now, I'm enormously proud of the accomplishments that we have done this year, from education to health care, but nothing means more to us than this SCHIP. The American people expect us to tackle this health challenge before us. Last week we fell short of overturning the veto by just 13 votes. To those members who know that providing health care to vulnerable children is the right thing to do, I say to you, join with Democrats and Republicans and with the American people in passing the bill today. Healthy children make a healthy nation, Mr. Speaker. I hope every member takes a long, hard look at the bill that we are presenting today and sees not just the words or the numbers, but the faces of 10 million children whose fate they hold in their very hands. It is time to put principle before politics. It is time to stand in defiance of misplaced priorities. And it is time, Mr. Speaker, to vote with our nation's children and provide them with the health care they need and deserve. I reserve the balance of my time.
Gentleman from New York reserves the balance of her time. Gentleman from Texas.